All right, recapping our shoulder workshop. So the main things that we went over in our shoulder pain workshop and shoulder mobility workshop is, one, we need to be able to create space in our shoulder. That is the first thing. If we don't have any space to move our shoulder around, then we are going to get in a scenario where we're compressing soft tissues, bone-on-bone connections, stuff like that, things that we don't want. That was number one. Number two that we're looking for within shoulder rehab program, or to get you more mobility or get you out of pain in your shoulder, is to start to reduce compensations and also challenging ranges of motion to make sure we have the most control and mobility as we can. And then the third one that we want to do is then we want to load our shoulder. Then we want to load it. We want to put weight against it. We want to make it strong. As soon as we reduce the compensations, we need to be able to then create some strength around it so we know that that change is going to hold, and we don't fall right back into those old patterns that we had before. So what we did specifically in our shoulder pain workshop actually started with breathing, because breathing is the start of everything that we do here, and this is why we get our patients better. So the first thing we were doing was mapping out, are we able to breathe throughout our entire thorax and abdomen? And it started with, can we put our hand on the chest, hand on the stomach, and then breathe only into our stomach, inhale and exhale. So that was number one. The second one was, can we keep our stomach down and then breathe into and have our rib cage expand 360 degrees. So we're holding this one very, very firm. And then we're doing our best to expand our rib cage after that. The third thing we were testing was, are we able to create a little bit of a pelvic tilt and now breathe into our abdomen and feel our low back and essentially our back pressing against the ground as we are breathing. And then the fourth thing we were looking at was, as we breathe, are we able to get the apex of our lungs, so right here, right behind the collarbone. As we breathe in, do we have the ability to expand that, to send that area upwards? So that was number one. That was our start. After that, we did 2 space-creating exercises for our shoulder. So the first space-creating exercises that we did, we get in this little army crawl position, and for some this is not easy to do, but for those that can, this is going to be a really good one. We're going to get in our army crawl position, and we're going to put a foam roller underneath our pec. And then what I'm going to do is I'm going to use my body to roll myself forward. I'm going to use my hand to press down, and I'm going to slowly drag myself back. So I'm going to roll that forward, press down on the ground, slowly drag that back. So what we're very much doing with this one is we are trying to create separation. We're trying to pull that shoulder out and create that space that we talked about. The second one that we got into as far as a space creating exercise was a very simple foam roller compression into our ribs with our arm up, breathing gently through our nose and then exhaling, letting our body melt into the foam roller underneath us. So if we're able to do that, big inhale, big exhale. Now we're going to create some more mobility in the rib cage. The rib cage, the shoulder blade, and the shoulder joint itself all work together very, very closely. And when we're able to influence the right motion at each of these areas, we know we're going to get more mobility out of ourselves. So this is why this one is very, very important. The first compensation reducing exercise that we did was a very simple shoulder car. So what we did here was we laid down and we actually braced our head with one side. And then very slowly, we started to bring our hand up. So my palm is facing my face, and I'm slowly bringing this up until I run out of room, until I run out of real estate. From there, I'm going to slowly start to roll this back, and then thumb is going to be pointing towards my belt as I go back down. Now we are going to do the same thing going backwards, where the thumb is staying pointing towards the belt. We're working that back as far as we can, and then we're starting to slowly work that around. So what we're really doing here is we're creating really good control in our shoulder motion at the end ranges. So these are the end ranges of shoulder motion that I have. And the more time I spend working into those ranges of motion, the better and the stronger, the more control I'm going to have throughout my shoulder. And the fourth one that we did not get to was a very, very simple, very good arm bar, where we are going to take a weight of any sort. This could be a dumbbell as well. And we are going to put one leg up, and then we're going to put this arm up towards the ceiling. So I have the weight pressing me down that I have to reach against to reach up towards the ceiling. So now what we're going to do with this one is we're going to turn our palm up facing us. And as I'm doing that, I'm going to turn my head to the side. And I'm going to inhale and exhale. And then I'm going to slowly start to roll this down, back the opposite way. Inhale and exhale. So not only is this one creating space for us, but it's also creating the right position, because as that weight's pressing us down and we're reaching up, now we're creating the right position as we're breathing and we're turning. And that exercise specifically is tying all of our stuff together. It's the breathing, it's creating the space, it's using the right muscles to create the right motions in our shoulder. If you found this interesting, if you found this approach interesting, you are in luck, because every 2 weeks we do an in-house workshop where we take people that are looking for mobility and people that are in pain, and we show them what it's going to take in order to get from pain and stiff to being able to use their body the way that they want to for the next 10, 20, or 30 years. If this is interesting, I want you to give us a follow, because we're going to be announcing these every 2 weeks with different topics. And if you have any questions about these exercises, you are free to reach out to us on any of our socials or our email in order to get a more tailored approach to what you're dealing with.